Welcome to our webinar, Living with MDS, a patient panel discussion. Thank you for joining us. My name is Leigh Clark, patient educator, and I'll be moderating the session today. As we get started, I'd like to recognize the generous support of our corporate sponsors and the generous support of our patients, families, and caregivers for supporting the program today. Due to the high volume of teleconferences on the internet, it is possible you may lose your connection during the program. If you are unable to view the program, you can call in to hear the audio portion using the call-in number in your reminder email. Today's program will be archived to our website within 2 to 3 business days. You will be notified by email when it is live and ready for viewing. Immediately following the presentation, during the presentation, there will be a question and answer session. Please feel free to submit your questions or your comments during the session. To submit a question or a comment, open the Q&A window in the lower part of your screen. Type in your question or comment in the small text box window, and when you have finished typing, just hit enter. We'll be going through the questions as we're during the program. When asking questions, I do ask that you respectfully do 2 things. First, submit your question all at the same time. Second, please do not share any private health information in your question. Our speakers are not healthcare professionals and are not able to answer any specific questions related to your healthcare. Our panelists today, we have Lou, Shirley, and we will have Rebecca, who will be joining us shortly. Welcome, Lou. Welcome, Shirley. Thank you for joining us. Shirley, would you like to start by introducing yourself?
I'm Shirley O'Brien. 4 days ago, I was in Oregon with a lot of rain and cold, and today I'm in Arizona. And it's lovely and 70, 76, 77 already. So I'm delighted to be here.
Thank you, Shirley. Lou?
Hi, Lou Auerbach. I live in a town called Belmont, Mass. It's about 8 miles as the crow flies from Boston proper, and it's cold here, crisp and cold. So.
Well, thank you both for joining us today. How did you, what was happening at the time that you were not feeling well and in the process of being diagnosed with MDS? Shirley, would you like to start?
Well, actually, I never did have a real feeling of sickness. How it started was I had my annual wellness exam, and my blood values and the blood counts were very alarming. I really didn't know much about it at that point. And so the doctor said, you need to see an oncologist. And that, of course, I thought, well, an oncologist is a cancer specialist, and that has nothing to do with me, but I did. And then the bone marrow biopsy was pretty revealing. And so I got the MDS designation, diagnosis, and immediately started on Vidasa 7 days a week for 28 days. And I never really felt bad during that time. I had a lot of bruising, which I thought, hey, that's old age. I remember Mom. That's just heredity. But that began a long journey 7 years ago now, that I've gone from MDS transformed to leukemia, AML.
Thank you, Shirley. Lou, what led to your diagnosis?
I actually stumbled over my, I had a blood panel drawn before I went to a weight loss clinic at MGH, Mass General Hospital. Went there. My white only was in the high teens. You know, it's typically, I think, 7 or 11. At the clinic, they pulled it again. Figured it was a fluke. I got the results the next day. Then I got in touch with my PCP. I thought I had diverticulitis because my only relationship to high white was my diverticulitis. I had a CAT scan. Results came back negative. I was introduced to my, I call him the HEMOC, the hematologist oncologist. Had a bone marrow biopsy, revealed. So I have an interesting MDS diagnosis. It's called MDS, MPN, overlap, unclassified, and I had 4 mutations and a chromosome deletion. With my MDS illness, so I was diagnosed over 2.5 years ago. Is that right? No, sorry, I'm thinking the MDS portion. Over 3 years ago, I kind of surreal because if you look at the MDS symptoms of bruising, potential night sweats, shortness of breath, all of there's like 10 classic MDS symptoms. I had none of those. So, and I was fortunate that I did not have blasts. So that was how, I stumbled on my illness, and I still call my bone marrow failure surreal because I do not have any physical symptoms. I mean, it's, you can't see your illness, so but you have the illness, at your long bones.
Thank you. What did your doctor tell you about your diagnosis? How did they explain myelodysplastic syndromes to you? Shirley?
Actually, I had a career as a professor, and so I took on MDS as a research project, and I educated myself over many months, and the internet was invaluable to me, and the resources, and here's a plug for AAMDS, the resources that I got for free were just invaluable, and the webinars and the patient coordinators, I just took it on as something I had to learn myself. The doctors, I don't know, that they would explain it, but it was not. Actually, I sometimes I explained it to them. I kind of took on quite a heavy load of educating myself and all of the resources that I gathered, and so I kind of sometimes felt I knew more than I was getting, and that's fine because some of the generalists really are treating such a wide variety of cancers, and I had some of that when we traveled. And so, you're your own advocate. You've just got to do it for yourself. And I did.
Thank you. Lou?
My doctor informed me the time he presented the bone marrow biopsy is that I have a bad mutation and I have a bad deletion, and my only cure would be a transplant. We talked about the IPSS-R, the prognosis, not being too long. And he was a proponent of, having the transplant. One thing that he couldn't provide me, and I've had 3 other HEMONC consults, nobody could predict your trajectory. So I had 0 blasts and I had a problem with my neutrophils, but as part of his diagnosis, he couldn't really predict when my illness would, move or change direction. So unfortunately, vague information, you start to Google your illness and I tried to get information from like either Mayo Clinic or NIH or reliable medical resources. Once again, my hem-onc was at MGH, Mass General Hospital in Boston, and they actively partner with Dana-Farber. So the medical information that I was given to him about my illness was the best they could come up with or predict at the time. And things always change. I mean, so that's my hem-onc, exposure to me with regard to my illness.
Thank you. At what point did your doctor, Lou, you alluded to the IPSS scoring system. At what point did your doctor discuss with you your risk level and what the IPSS meant for your diagnosis?
Are you asking me or Lou?
We'll start with Lou.
So I wanted to get clarification on what my illness characterization could be, and he called me high risk due to the fact that I had mutations. Okay, so he put me in that bucket. With the IPSS score, for the longest time, I didn't hear the untreated adjective caveat to the IPSS score, which means untreated, this is how long you're going to live. But, as soon as you get treatment, some people who have a sense of urgency because they're blasting, they're treated now. So the IPSS score is essentially, thrown out the window. But all they have are these statistics where when I Googled it and looked, he provided me information of 12 to 24 months, and I Googled from NIH 19 to 24. So you're in that ballpark. They are working on a dynamic IPSS-R score. Cleveland Hospital, there's an individual that is making marked improvements to make the IPSS score more dynamic. And he presented at 2018 ASH. So I self-advocate a lot. I self-advocate to try to make the best informed decisions about my illness. And, it's exhausting.
Thank you. Shirley?
My experience was really fairly devastating. We were performers after we retired. We played digital accordions. And so we said, this MDS is definitely not going to stop our performing. And so we started to travel in our motorhome, and we'd go to the Pacific Northwest, where there are wonderful ethnic festivals. And we would play on stage and use our motorhome as sort of our staging area for the summers. And so I became a patient at a Northern Idaho Cancer Center and got my Vidasa infusions every 7 days, 7 days and every 28 days. And so I had just countless bone marrow biopsies. And after 20, I lost count. So I had one last one before we were going to leave Idaho. And we had a condo there at that time. And so we had sold it. And the oncologist said, Shirley, I've got a new app. And I had the same app on my phone at that time too. And we can plug in your values and we can see what life expectancy is going to be. And he said, after the bone marrow biopsy, he said, something new has come up and I want to plug that into this app. You have a mutation. And I hadn't had any mutations at that time. That was something new. And he said, this really was going to change things. It's an IDH1 mutation. And let's see what it says. And so I didn't have an appointment because we were leaving, and we were talking in the lobby, And he said, "Oh, Shirley, I'm sorry. We're looking at 4 to 6 months." And I said, "What?" And he said, 4 to 6 months. And I totally dismissed it. That's not true. And Jim was waiting for me out in the motorhome in the parking lot. And I didn't even tell him. Jim is my husband. And I didn't even tell him because I totally dismissed it. However, when we came back to University of Arizona Cancer Center a few months later, they confirmed it. And what they said then, which I wish I had heard early on, what they said then is you need to find a clinical trial and you need to find it now. So that's how the app of the IPSS was introduced to me, and that was the turning point when I discovered that I had just a few months to live based on that.
Did either of your doctors tell you that MDS is considered a cancer? Shirley?
No, I can say that, but I could find that out by reading some of the things that were said. I could say that somebody did tell me once, and I'm not sure if it was a doctor or something, but it sure did stick with me. MDS is just another a 3-letter word for leukemia.
Lou?
Not, he didn't directly inform me, but the area that I went for the clinic, it was bone marrow transplant cancer center. I mean, I was in the cancer center floor. My floor was BMT. The other side was for breast cancer. So it's just, implied that my illness was cancer.
Thank you. After your diagnosis, how quickly did your physicians begin talking with you about treatment and what options were presented to you? Shirley?
Immediately, I met with him and he said, your diagnosis is MDS. I think it was on a Thursday. And he said, Monday, we're going to start Vidasa and you're going to get an infusion. And I would suggest that you immediately get a port catheter because this is going to be the long haul. So it was very immediate to get that. Then it was later, probably another couple of years later, because I was doing really, really well. I was on Vidasa for 3.5 years, which is way longer than the average. And so it was a couple of years into that they said, you really ought to consider a transplant. You really, Vidasa is going to fail, and it did. Vidasa will not go the long haul. And so that's when I started really looking seriously into transplant, which scared me to death.
Thank you, Shirley. Lou?
With regard to therapies, initially, for me, due to the fact that I had 0 blasts, there was no sense of urgency to discuss therapies. The important thing early on was to introduce me to the bone marrow transplant doctor to review the process and pursue a match to just get things in order. So further down the road, so I was diagnosed September 2017. Come March, only one of my blood values started to creep up, my neutrophils. And 5 months later, I had to discuss therapies to control my white blood count, which, interesting enough, for me specifically, the neutrophils were going up and they were associated to this mutation called CSF3R. So I got this mutation, the neutrophils went up, I started oral chemotherapy, and because he didn't want me, he wanted me to take an oral drug at home and not go to the hospital to get the cytidine or azacitidine, or he even mentioned that they could do a cocktail. But he wanted to keep me at home and not have to go, into the hospital all the time. So my therapy started 5 months later when my bone marrow changed.
Thank you. Lou, this question is for you. How much of your diagnosis was penned on gene mutation, and how did you feel before you had your transplant?
So I'll just go into now about my transplant decision. There are 3 aspects which precipitated my wanting to engage in a transplant. The first aspect is blasting. For over 2.5 years, I had 0 blasts, and then I went up to 8%. The cytidine brought that down. So blasts are number 1. Right behind that, I originally had 4 mutations, then I had a 5th one, and then about 2.5 years out, I had 2 more. So now I had 7 mutations. So I said, I'm only going to get more. And then the third attribute for my bone marrow failure derived from a biopsy is what's called marrow cellularity, how full your marrow is. And I originally had 70%. 2.5 years out, when they discovered the blasts, I had 95%. And normal adult males my age, it should be 20 to 30%. So those are the 3 things that precipitated me to engage in a transplant.
Thank you. And the other part of the question was, how did you feel before your transplant?
Well, as I mentioned before, for me, I fortunately, I feel good. I focused, my energies on getting my house clean, to have a clean environment. And I just had to be positive, thinking that, I'll go through the transplant and it'll be one day at a time, and we'll see what comes out the other side. So through my bone marrow failure from the beginning through even now, I don't have, physical symptoms. I don't have fatigue. I don't have shortness of breath. I don't have night sweats. All of the major characteristics of having this illness, no nausea, no vomiting, no nothing. So I'm extremely fortunate through this process. Like I said, surreal.
Thank you, Lou. And Shirley, we have 2 questions for you. First is, how long have you been diagnosed with MDS?
I was diagnosed in February of 2012. So it's been quite a while ago.
And the second part is, how long ago were you told that you had 3 to 4 months of a prognosis?
That was 2015, the summer of 2015. In fact, it was June 6th. You tend to remember those things. And then, of course, as I mentioned, I dismissed it. And it was when we came back to Tucson, which was October, it was confirmed. So that was 2015.
Thank you. Lou, we have a second part for your question regarding transplant. Do you know what the mutation was that was pinpointed to be a problem?
So my worst mutation was ASXL1. So that was what he considered to be the worst. And as a sideline, I self-advocated mutations. There's 111 mutations they check, and if you look at any of the mutation histograms, you see ASXL1 like near the top, most prevalent for bone marrow failure mutations. So that is percentage-wise worst, and that's why my hematologist said it's bad.
Thank you. Our next question is, how did you go about finding a MDS specialist? Shirley?
I really didn't. When I was diagnosed, it was a matter of this person treated many different kinds of cancer. So basically, I guess at the beginning, if I have to say this out loud, which I've learned so much since, I just wanted to stay close to home. This was something new and different, and who's the oncologist that is the closest? And that's kind of where I started. Then, you know, as we went deeper into this, we went to Moffitt, and we flew to Cleveland Clinic, and we went twice to Seattle Cancer Care Alliance, University of Arizona Cancer Center. Then I really did the research on finding some of the people that I thought I could get some really good answers from. But at the beginning, hey, this is something I'm just going to deal with. But in fact, this was what was interesting. Jim and I heard the diagnosis, and we left. And I said, you know, I can't cook dinner tonight. This is I just can't. Let's go out to eat. We didn't eat out much then. And so we went to our favorite Greek restaurant, and I said, well, you know, we'll just take care of this, and I'm sure by the time we get ready to go next summer for our tour and do our music, it'll all be over. And he said, that's not what I heard. That's not what I heard at all. He said, this is something that you're going to live with for the rest of your life. And I was just shocked. Didn't finish the dinner, by the way. It was a real shock because that's how closed you are. You don't hear what is being said. And what's so important is to have somebody with you, somebody that can hear what's being said. I didn't.
Lou, how did you go about choosing the right doctor for you?
So, excuse me, my medical center is Mass General Hospital, and I have a PCP since the 1990s. My PCP directed me towards a hematologist, oncologist in a different department. So, but he was number one. And like I said, with this illness, you want to understand the trajectory of when things are going to happen to you. So I did, I saw 3 other hem-oncs. After number, my second one is I actually went to Dr. Azza Raza in Columbia, New York. I went to, my third one was Dr. Richard Stone at Dana-Farber. And my fourth one, I went to see Dr. Gail Robos at Cornell Wheel in New York City. Nobody could provide me a trajectory. You know, I'm not saying, I mean, I feel good, but emotionally, when you hear from the doctors and you talk about it, you leave the office, you know, you feel like a ton of bricks, you know, drops on you. And, you know, I was fortunate. for the first appointment to go with my MGH doctor with my wife. The other ones, I went solo, but I had a lot of questions for them. The session gets very complicated with your hem-onc. The one positive thing I like to tell people is that, interesting tangent, when I saw Dr. Richard Stone at Dana-Farber, I said, Doc, it took me a week to get an appointment with you. And he said, we pride ourselves in getting our patients in here because, we know the degree of severity of the illness. Going further down the tangent, I had the same experience getting an appointment with the Dr. Raza at Columbia and Dr. Robos at Cornell. And because they were not on my portal system, I found it more difficult to pull my medical information, my recent medical information together, to send it to them to actually schedule an appointment. So getting an appointment at the Center of Excellences, people, if they have the time and want to pursue another opinion, they should, consider pursuing those. Just have all your recent medical information available to present to them in whatever means they want.
Thank you, Lou. We have a question from our audience. Do either of you suffer with low platelets? Or did you ever have low platelets? Shirley?
Yeah, definitely. That was a part of the details of blood counts right at the beginning. One of the first issues that I discovered at the very beginning was that the white blood counts were going to be a real problem. And the absolute neutrophils were the frontline defense, and those were not acceptable. Platelets were not acceptable. The red blood cells were not acceptable. So I really had to educate myself on what each of those counts meant and how that hopefully in between the infusions of azacitidine, I should say, rather than Vidasa, perhaps that would stabilize them. And that did happen for a couple of years, but then all of those started just creeping down in between each of my infusion times, that 3 weeks in between. Each time it was just a little less, and I could see where we were going with that. And then it did fail in the summer of 2015. And they actually would not give me any more. They said, it's not doing you any good. It's probably doing you more harm. And so that's when I was told I had just a few months to live.
Thank you, Shirley. Lou?
My experience with platelets, having low platelets, were just a side effect of taking hydroxyurea and Jakafi, which lowered my neutrophils and in parallel lowered my platelets. So my neutrophils were high. I needed those two drugs, so my platelets went down. That's my experience with having my platelets coming down. It was due to that oral therapy.
Thank you. We have another question from our audience. They'd like to know, did either of you receive Procrit as part of your treatment? Shirley?
No.
Lou?
No, I haven't had it.
Thank you. Did either of you receive blood transfusions as part of your treatment? Shirley?
That summer of 2015, which was the summer from not a good place, my red blood cells were down to 7, and they had, in this little coastal town where we were in our motorhome and living that summer and doing our festivals, they said, if it drops below 7, we're going to transfuse. And it just hovered. And so finally, we decided this is getting really, really serious. And that's when we went back to Tucson. And then that was the beginning of the clinical trial experience. So I didn't have any transfusions until I got into the clinical trial. And then I had red and platelets. And I was always told, you know, you want to keep your white cells up, Shirley, as if I could do something like that, because we can't really transfuse effectively white cells. So my transfusion time came at MD Anderson in Houston. That's when I first had some transfusions.
And Shirley, did you ever suffer from iron overload due to numerous transfusions?
No, I didn't have any really numerous. I think I've had 3 reds and 1 platelets. That was the extent of my transfusions. And that all was after I began the clinical trial.
Thank you. Lou, did you, for any period of time, need transfusions?
The only time I needed transfusions was right after my bone marrow transplant, because, you know, all of my blood numbers were low because I had the chemo. So when I was in the transplant unit, I had red and platelets a couple of times. More recently, it's interesting, post-transplant, I am using Jakafi to control my GVHD skin problem. And Jakafi is behaving differently now than when I was taking Jakafi with MDS. Taking Jakafi now, actually, it really lowered my hematocrit. So I had problems breathing, and I required, you know, the irradiated red blood cells to boost my hematocrit. But once again, my necessitation for having a transfusion was derived from having Jakafi affect my counts.
Thank you. At what point in time did your doctor ever discuss with you the possibility that your diagnosis may transform to AML, acute myeloid leukemia? Shirley?
I cannot remember a time that any of my physicians actually said that. It was something that I read, something that I figured out from looking at so many different blogs about transplants and about how MDS does not have a cure. My goodness, I think I picked that one up right at the outset. And those were the kinds of things that made us go to Moffitt, you know, or Cleveland Clinic and get other opinions, Seattle, because the transplant was a really scary thing to me. And I just thought, and you know, I was old, let's face it. When I conferred with Mayo, they gently told me that I couldn't have an appointment because I was past the age of transplant. So, you know, almost at the start, a transplant would have been a really risky thing. And so I was kind of between a rock and a hard place for a couple, 2-3 years. But I have to say again and again, our music saved us. There's nothing that feels better than standing on stage and performing and having people applaud. And I'll tell you, that carried us through some really dark times when there seemed like that there was no out for this. And of course, the clinical trial saved my life.
For me, progression to AML was never discussed because I believe it's something that my doctor didn't tell me, but I did a lot of self-advocating on genetics, genomics, and looking at mutations. And the type of mutations that I had were not conducive to transition to AML. Now I'm going to say something which people who have questions about transitioning to AML, once again, this is my self-advocating knowledge, but I believe that there's a field of mutations which are more conducive to transitioning people to AML. And I think that if people have the question, they should direct it to their hem-onc to see if their hem-onc concurs. And I know that one of Shirley's, the IDH one, in my opinion, like I said, I'm not a doctor, but if you talk to your hem-onc, the IDHL is, I believe, a mutation is conducive for the transition to AML. So, you know, there's a lot of information. I mean, I go to my hem-onc with my pad. I have questions before I go because if we're starting to talk about things, we get off tangent. I want to make sure that my questions are answered and the information he presents to me are written down so I could, you know, have formidable conversations with the doctor. So once again, to review, AML was not part of my particular conversation.
Thank you. This question is for Lou. It says, Lou, do you have any acute graft versus host disease symptoms?
Yes, I actually, I do. I'm in a transition point. I spent 20 days in the transplant unit, positive experience. Got home 2 days later, I started to have rash that just spread through my entire body. So I had skin GVHD. They initially gave me creams to control the rashing and itching. That didn't work. I went on prednisone. It's part of what I call the GVHD scoring system. You know, when you go through a transplant, they evaluate your gut, your digestive system, your liver, and your skin, and they weigh it. So I was acute, went on prednisone. As I was tapering down prednisone, I went on Jakafi as a secondary skin GVHD therapy. But if you Google skin GVHD, there's about 15 different therapies. Once again, talk to your transplant doctor. Your medical center has guidelines for how they want to pursue, you know, the curative properties to help resolve your GVHD. I have no skin issues now, and I'm hoping to taper off of Jakafi. And I'm 180 some odd days post-transplant, and I'm hoping post-transplant, biologically, I'm beyond skin GVHD, but that's still a big TBD based on how your body is reacting post-transplant. Pure speculation. There's no trajectory from the doctors. It's just, you know, day by day, trying to figure out and discuss with your doctors and determining the best therapy for you.
Thank you, Lou. We have another question from our audience. Did either of you experience lack of energy or issues with breathing? Shirley?
I can't really say that I experienced that extensive fatigue that they always talk about. I do know we live on a little hill here in Arizona, And I do know when in 2015, when I was in bigger trouble than I would accept or that I would think about, uh, getting up the hill here, I would have breathing problems. Uh, and I'd finally get to the garage door and take a deep breath and think, well, that's just, I'm old. A lot of my MDS was really just being old, I thought. I think probably that was my escape. I didn't really accept it that much.
Thank you, Shirley. Lou?
I had no breathing problems with MDS when my blasts were 0 and then even creeping up. I had shallow breathing problems a couple of days after transplant because I essentially had no blood in no kind of usable blood. Your post-transplant and getting your cells developed. Most recently, shortness of breath due to what I explained before, the Jacophy having effect on my hematocrit by having, a moderate dose of Jacophy where it would affect the hematocrit, which in turn I would have shortness of breath some periods of time during the day, random periods of time during the day. It wasn't consistent, the shortness of breath.
Thank you. Lou, this question is for you. Was it your transplant doctor that decided when it was time for a transplant, or was it up to your cancer doctor?
None for either of them. It was my decision. Because I had a 24 to 48 month prognosis, my hemonc always at every appointment mentioned, when are you going to transplant? My transplant doctor just mentioned to me, you're feeling good. There's going to be a point in time where you're not going to be feeling good. We want to make sure that we get you in. But my transplant decision was purely mine. I mentioned the 3 factors previously, the blasting, increased mutations, and the increased cellularity. And I thought that it's not getting any better. I don't want to Band-Aid decitabine or other treatments. I should try to feel as good as I can and schedule in the transplant. So it was purely my decision. I was, once again, my hemonc, I conservatively saw him every month. And he'd ask that, like question 2 or 3, when are you going to do it? And then I initially saw my transplant doctor. I saw him a year later just to touch base, but because once again, I was feeling good, it did not necessitate the need to get me into transplant. One of the big criteria that I'd always go and discuss with my hemonc was, since he mentioned transplant, I said that, we talked about 0 blast being the big criteria. When I start to blast, that is the time when the decision, that's the big tripping point. When your marrow, you get the immature blasts in your marrow. So it was my decision.
Thank you, Lou. And did you have a related or an unrelated transplant? What type of transplant did you have?
I had MUD, matched unrelated donor, as they say.
Thank you. Shirley, this question is for you. Would you like to share your clinical trial experience, and what trial did you participate in, and how long ago was your clinical trial?
Well, we were talking about blasts a little while ago. I did not have any blasts either until I was submitted my materials to become a patient at MD Anderson in Houston. And Dr. Courtney DiNardo had said, why don't you come for tests, which we did. We flew in just before Thanksgiving of 2015. And then she said, after the tests were revealed, she said, I think that I'd like to invite you to come and join the trial. And you need to be here for a couple of months. And I said, oh, we couldn't possibly do that. We have some very important musical responsibilities in Tucson. What we'd been doing is every holiday season, which is right about now, this is so interesting to be talking about this, 5 years ago, right about now, we said, we'll give you 30 minutes of live music for your holiday party for a $50 donation to the food bank. And it was always way more than $50. And we would raise $2,000, $3,000 over the holiday. And so we came back from that conference with Dr. DiNardo in Houston, and I had 10 parties booked and I canceled 10 parties. And we got in the motorhome and we drove east on I-10 for 1,500 miles. And we landed there in early, I'd say just almost about now, 7th, 8th, 9th of December at a motorhome park that Dr. DiNardo had mentioned that some of her patients were at. And I began the trial on the 23rd of December at 1:30 in the afternoon. And I took a selfie. I'd never taken a selfie before. I didn't know how to take it. And the text showed me how to take a selfie. Somehow or other, that just felt like it was an incredibly important moment in my life. And now I have had 5 years of being on the oral IDH1 Tibsovo pill. I take 2 pills, chemo pills, every morning, and I have no side effects, and we went right back to our music. And I didn't have any blasts until we started driving from Tucson to Houston. And somewhere along that route, I developed some blasts. So when I landed there, I had blasts, which is maybe somewhere around El Paso, who knows, somewhere in that area. And like I said before, that Tibsovo IDH1 clinical trial has saved my life.
And we have a question that says, Shirley, what is the best way to find a clinical trial that is suitable? How did you find your trial?
That was a very interesting situation. When I was told here at the Cancer Center in Arizona, you need to find a clinical trial and you need to find it now, I kind of just thought after I left that appointment that they would give me a variety of options. And I was wrong. I went on clinicaltrials.gov and I spent many a night, in the middle of the night actually, searching for a trial. And it just totally seemed above my pay grade to try to find a trial that would be IDH1 focus. And out of these thousands and thousands, how do you do that? So I get emotional because I'm looking at you, Leigh. I called and I said, I'm in trouble. I'm dying. I'm desperate, and you've got to help. And what did you do, Leigh? You tell me.
I said, give me 24 hours. Give me 24 hours.
And you did. 24 hours later, you sent me 5 clinical trials. You did the work for me, lady. You did. I'm forever grateful. And the third one down said Dr. Courtney DiNardo, MD Anderson, Houston. And that's how I found the right clinical trial. The other 4, maybe they would have been right, but it's been a wonderful journey, and it's been a wonderful time being able to respond and say AAMDS was a big part of saving my life. And you were.
Lou, and actually for Shirley also, how has COVID impacted your treatments, and what are you doing to stay safe? Shirley, would you like to start?
Well, even though I think probably I'm as healthy as I can be, you always know what you've been through. And you know what it's like to have an incredibly just a vacant immunity system that doesn't much exist. So when you look at what's going on around you, you just are extremely careful. And I haven't shopped in a grocery store for what now, 9 months? I get all the groceries delivered into my trunk of my car, order them online. I don't shop anywhere. We haven't entertained. We haven't been entertained. We don't gather in groups. We wear a mask. We wash our hands. We not only social distance. We just completely don't gather. It's okay. It's okay. I'm living a wonderful life. We're doing a lot of music by Zoom, and we're doing a lot of music creating YouTube tracks. So we're keeping our music going.
Lou?
COVID has been difficult, thinking that you have to be all about being clean. Having masks, washing your hands all the time, sanitizing. My wife is my transplant caregiver, has a responsibility. We try to limit shopping, and every time we bring food in the house, just clean items. Yeah, it's terrible being isolated. I think I was okay for 2/3 of this duration, but you know, you get a little stir crazy of just, you know, being isolated, but having no immune system. But when it's slowly building up, you know, you realize you have to be safe. I'm fortunate that at MGH, the Cancer Center building has less traffic in it. So I feel good that when I go in there and go through the screening and then get on the elevator, what I'll call the point of contact, every time you touch something, you know, you're traceable to something. So getting on the elevator, you know, doing this, going to the door, even going to the bathroom when you have to. I mean, you're always thinking of contact tracing, you know, who used this when, and I just spray my hands all the time. I just try to be as safe as possible when I leave the house, and very aware of how my wife's feeling. Like the number one COVID is the high temperature and then the throat problem. So it's been a challenge to try to be as safe as you can, as clean as you can through having no immune system and dealing with COVID-19.
Thank you so much, Shirley and Lou, for spending your evenings with us, sharing your expertise and your journey with all of us. If you would like to watch this webinar again at a later time, it will be available on our website within 2 to 3 business days. If there's anything that the foundation can do to assist any patient or family, please reach out to us. You can contact us by 3 ways. Please send us an email at help@aamds.org. You can reach us on our helpline, which is 800-747-2820, extension 2, or you can contact us through our Facebook page. On behalf of the Aplastic Anemia and MDS International Foundation, Thank you for joining us this evening, making us your resource of choice on information on bone marrow failure diseases. The AAMDSIF Medical Advisory Board and team are here to support you and your family as we have done for the past 37 years. This concludes our program. Thank you, Lou. Thank you, Shirley. Happy holidays to everyone.